Hi, I'm Dr. Keith Lawrence, and I'm here in St. Louis, Missouri, and the spectacularly beautiful Forest Park. This is over by the Science Center, which is over here to my left. And if you look to the right there, we have the illustrious Barnes-Jewish Hospital, a wonderful complex that's been there for several years, serving the residents of St. Louis, Missouri. Just a fascinating thing about St. Louis, we have a lot of beautiful sights, tourist attractions, restaurants. Not to mention, of course, we have the highest rates of crime, murder, illnesses. So this particular documentary is titled Sick in St. Louis. I mean, think about it. You know, as a natural health physician, I see a lot of patients. There are a lot of things happening here. So we like to take you with us on this interesting docudrama about the residents in the city of St. Louis, Missouri. Some of the amazing topics that will be covered are topics like escape the vape. Did you know in the year 2019 there's an epidemic of people vaping? Yeah, people who don't smoke regular tobacco-laced nicotine-controlling cigarettes, they use another substance called vaping. But the things and chemicals that are in vaping are just as deadly. And how about this? Why is it that we, particularly us as African Americans, in the religious scene, why are all the ministers and pastors and elders and deacons and all the teachers overweight? So I have an interesting program. It's called Fat Like That. I mean, why are we fat like that? Think about it. If we're teaching the gospel, doesn't the gospel talk about health? If I don't recall incorrectly, I believe it was 3 John 2 that says, "Beloved, I wish of all things that you should prosper and be in good health." So why are people in the churches fat like that? And another interesting topic here in the city of St. Louis. Did you know in the state of Missouri we have the highest rates of sexually transmitted diseases? Yeah, good old St. Louis Mo, as they say, in the Lou. Now, this particular documentary is not belittling or bashing the city of St. Louis, because all the cities in the United States of America, and I mentioned around the world, have some serious health issues. But the way these health issues are being addressed, it's not actually helping those who need help. Actually, it's being promoted by the pharmaceutical companies who are killing our people. I mean, did you know, particularly, that the food in the hood definitely ain't good? Yeah, that's another little snippet I'll be talking about, how in the African American communities, we have some of the highest rates of hypertension, diabetes, cancer, renal failure, and all kind of health issues based upon what we consume. You know, someone once said to me some time ago, we don't catch diseases, we buy our diseases. Oh, so. And did you know, because of most of the areas geographically, you'll find the highest concentrations of McDonald's, White Castles, Mickey D's, Arby's, all these fast food restaurants. And also a frightening statistic. It came from California, but it's all over the U.S. But I'm going to be focusing in the city of St. Louis. Did you know we have one of the highest incidents and statistical rates when it comes to drive-by, not deaths by shootings, but death by drive-through? Because when we traverse the drive-throughs, consuming those foods that are laced with chemicals and fat and high cholesterol, things that are going to kill us, more people are killed by going through the drive-through than are killed in drive-bys. And also one of my little pet peeves, it's called, "What the fork are you eating?" I said fork. Do you know we cause more health issues with a knife and a fork than all the people who've been killed in all the wars? Frightening statistic. And there's also several other statistics you probably won't hear about. For instance, our women and our men, we put more cancer-causing, tumor-forming, bone-destroying, metabolic, devastating chemicals on our hair, on our lips, around our eyes, on our skin, and we even ingest them, all in the sake for looking good. As someone once said, we're dying to look good. We're embalming ourselves to be beautiful. It should not be. There are so many health issues that are going on around the world. That's why I was inspired to do this particular documentary. I know, there's a lot of things going on out in the world. People are looking to doctors for help. And I'm not here to bash physicians, per se. But what I'm going to introduce you to expose and to share with you information on the healthcare industry, how you can get well at home, naturally, and a lot of things that you probably won't hear the average physician tell you. So, I invite you to come along with me as we explore the wonderful things that St. Louis has to offer, and also some of the things that you don't hear about. And before I end this little introduction, sadly, we have determined in the city of St. Louis to name a new national, or should I say, state epidemic. No, it's not caused by high blood pressure or drugs or too much fat or lack of exercise. This particular new statement, health crisis, health epidemic, is called death by trauma. What do you mean by that, doctor? Unfortunately, this year, from the year 2018 through 2019, we've had the highest incidences of our young people. When I say young people, I'm talking about adolescents, toddlers, babies, who are being murdered, shot in their homes, going to school, walking down the street, on the school bus, or just simply at home sitting on the couch, and they're being shot by stray bullets, deliberate bullets, intentional bullets. We call them casualties of war in the war. These aren't casualties of war. These are determined, predetermined, totally preventable deaths that we are doing to ourselves. We have a series of signs that are posted all around the city of St. Louis, primarily in North St. Louis. And these two signs say two primary things. We must stop killing ourselves. And it has interesting contrast. It says, we must start loving ourselves. And all those things are true. But unless we fully understand and truly love our neighbor as ourselves, this epidemic has no quick end in sight. So what I propose for you to watch, not at your enjoyment, but for your educational enlightenment, for your research, and hopefully for you to have better health, to save your health and your children and someone that you love. As we take this tour on Sick in St. Louis. Let's take a journey.